welcome back, Finca family, to this week's highlight. And it's a really special one for you as well because I'm here with some special guests from Animal Field.
Hi.
This is Natalia, Belen and Pablo in the back there. You'll meet them later, don't worry. But they've come all the way over here to spend the weekend with us, helping out with lots of treatments for our horses and our small animals and cats and dogs and everything. So they're going to come and do a lot of work for us.
Yeah, we're basically here, as Emma says, to do a kind of a volunteering and on the technical bit that we can give to your project, because we kind of love all your philosophy and your principles, so we're happy to be here to help.
We're so happy. As we always say, we're together, we're stronger, we can help more, and we're so grateful to have these guys helping. Yeah. So don't need any more of me talking at the moment. Let's get straight to the action, and they're starting with Phantasma.
Okay, so one of the things that we can help in Tenerife Horse Rescue is a little bit with the care of the horses bit. So now, as the first job, we're gonna try to start doing all the dentistry part of the horses, because it's really important for them. As they are herbivores, their teeth grow their whole life. It's not like us, that we have just permanent teeth and they stay there for the whole life. So they grow constantly because they kind of eat the grass, and with the mastication they can start getting like weird shapes, and they can start stabbing the cheek and the tongue, and that is really painful. That's why we recommend at least once a year to have the whole mouth checked, so we don't have any injury that can cause secondary problems like colics, and they start losing weight and so on and so on. So that's the first thing that we're going to do today, and Phantasma is the first one. Okay, so a dental procedure is not a painful procedure at all, because unless the teeth is really damaged, the nerve is not exposed. So normally when they are used to have dental treatments, no sedation is needed, and there's no blood in the procedure. So basically, as the teeth grow constantly, and the directions normally is like against the cheek and against the tongue, it could be painful. So in those sides of the teeth, and sometimes also on the sides that the teeth bump on each other, you have to file them slowly. You can use a lot of tools, electrical, not electrical, so you can have at the end a really smooth teeth, so you don't have any damage, and that can also help horses like her, so she doesn't have any inconvenience to get any weight, because it can be a problem to have a painful mouth, and that's all.
Belen is doing a dentistry review for this course, and she has seen that she has gold teeth. This is one teeth which is growing a premolar, and is something similar than our huge molars. When they appear, they produce pain, they are uncomfortable eating, and we are going to remove that tooth. He's going to be really comfortable. After that, the tooth is not going to grow up never again, and he's going to be really happy. So when she finishes to do the normal work with the teeth, we will remove it. We are going to do x-rays of this horse. If you see there, the fedlocks joints in the hind limbs are really shallow, and we need to see what's inside, and for that the x-rays is going to help really a lot. So we're going to use our machine, and it's so easy because we don't need any electricity, we don't need anything because it has own battery, and we have the flat panel and the machine, so it's going to be so easy. And we have the x-ray now here in the computer immediately. Okay, it's there. That's the x-ray. Ready. And it's ready for the next. Can you see here that the x-rays is the technique to see the bone, but due to the quality we're seeing the soft tissue, that, and this is the gund. Can you see here the both gunds? Okay, this is the fedlock. We have arthrosis there inside, okay, which is here, arthrosis in both, more in the right than in the left. We are continuing doing the x-rays, and this horse, we saw that he has a big lump here, which is really heavy and looks like bone, and it's in the area which is close to two different joints, the coffin and the pastern. So we are doing the x-rays to see what's that, if it's coming from the joint, and looking for if we can do anything to try to help him to be with no pain and as comfortable as we can. So we are going to do a proper diagnosis. Okay, now see here we see pieces of a little bit of arthrosis in the pastern. Mm-hmm. Okay, more or less a little bit here in the lateromedial, but in the dorsal view, can you see here in the lateral part that we have pieces of that arthrosis that has gone from the bone.
Yeah.
It's really scratching here, and we have the pieces here free, which are producing the thing that we are seeing
The
from
lump
outside,
from the outside, yeah.
the
Yeah,
lung.
yeah.
So that's another big arthrosis there, which should be hard. The good news is that the angles don't look
All right,
bad.
Smeagol.
We are going to use an auto measure because we have put the hoof here inside of this. We have one piece of tissue that we know where is it. The machine knows also, and I start now to compare the different joints to see how is alignment.
Okay, got you. Yeah.
Poor alignment.
Poor alignment, a little bit poor alignment. That's the base
Very
of
good
that's the base of the problem. Poor alignment, which is
Yeah.
producing that.
We've all sort of split up now so that we can get as many animals as we've done in one go. So me and Natalia, who have we done already? We've done
Chippy has done a filaria test.
That was fun.
and
She did a
he's
very good
negative.
job with that. That's good news.
Yeah, we trimmed Maggie's nails and he
Maggie's
was a
nails.
little bit scared, but everything is done.
Checked
And
up on
then
Nonna.
Checked up on Nonna and Iggy.
And
Tripod. And then
We're taking them off.
And then we're gonna check the name of the cat.
Yeah, Fuso.
Fuso,
We're gonna go,
to check if he's leukemia positive or negative, and if not, vaccinate him.
and then we're gonna go see the leukemia cats,
Correct.
Marmalade and Tattoo, and I'm all tangled up here. And I think that's it on our list. Well, we ended up staying up there to look at some more results, and then we're gonna test some more. But now we're gonna go do Fuso. We're just gonna check for leukemia, and then hopefully if he's negative, we're gonna vaccinate him, and then we're gonna go to the leukemia cats to test for them. And one in, one out. Fanta's gonna go have her x-ray now. It's all happening today, as many animals as we can fit in one go. And we're roping in all the volunteers. Goof. Huh? No, that's a scan, that's next. No, well, X-ray team, blood test team, and scan team is next once it gets a bit dark.
Hi again. So now we are with Fuso. Fuso is a kitten. He's around 5 months old, right? And he has never been tested against leukemia and feline immunodeficiencies. These two viruses are really important in feline preventive medicine. So we're just gonna perform the test on him, and we just need a little bit of his blood. Okay, so it has been more or less 10 minutes since we placed the samples and the buffer has run through the test. So this is more similar like a pregnancy test. So basically one line is the control, so it verifies that the test is correct. And the T is the test per se of the sample, so there's no line, so it's a negative. So the name of the cat?
Fuso.
Fuso. Fuso is negative against leukemia and immunodeficiency, so we're gonna give him his vaccination. Okay, so now we're here to check the cats that have leukemia, feline leukemia. These are really contagious diseases in cats, and it can be transmitted through the secretions, like saliva mainly, like when they fight and they kind of bite each other, they can be transmitted. So here at Tenerife Horse Rescue, they do it really well because they keep them inside a big area that they cannot be in contact with other cats, so we are going to avoid this transmission. So we are just going to check on them. At the moment they don't have any illness, but just to check that everything is okay. And vaccinate your cats, guys.
Vaccinate your cat.
He's fine. You're okay too.
So as you can see, it's starting to get dark and we still have horses and we still have guinea pigs to do and we still have a few more things to do and scans, but we actually need the dark for the scans anyway. But you're not going to be able to see what we're doing, so I'm going to have to love you and leave you from now, and thank you so much for watching the video. I hope you found it really interesting. I hope you learned something and saw the amazing team that's helping us with these animals. And as always, comment below your thoughts, give us a thumbs up, subscribe. Every time you comment, like a video, it all helps. And also give them a follow on theirs to find out more what they're up to. So I'm going to leave you with it, say thank you, see you next week, and we're going to get back to doing the last animals. See ya, thank you.